Health experts say the MECQ helped reduce the infection rate in Metro Manila, but based on the recent projections, the country will have 230,000 cases if high-risk areas like NCR ease restrictions and shift to GCQ. With another grim forecast and the discovery of a new COVID-19 strain in the country, what's the best option moving forward? Let's make sense of all the data from infectious disease expert, Dr. Benjamin Ko. Doctor, thank you so much for joining us on The Final Word. Lots of things to discuss about COVID-19. Let's start off with this new mutation. Are you surprised that there's one coming out here in the Philippines, or is it also expected?
Hi, good evening, Rico. Well, the reports have come out already from the Washington Post, and Malaysia has also actually reported a switch occurring in the part of the genome that codes for the all-important, what we call spike protein. The original SARS-CoV-2 protein is actually the D614. On the amino acid chain, it's called D614, and it has mutated supposedly to G614. And there are studies already that have come out on this, and I think it is as far back as July.
Yes.
That spike protein is a protruding structure. It's actually that structure that gives the coronavirus the crown. That's the reason why we call it coronavirus.
So doctor, a lot of pharmaceutical companies are coming up with their own COVID-19 vaccines. So does this mean that with this new mutation or this new strain, the vaccines that are currently in production will not work in these new mutations?
Well, actually, a lot of the vaccinologists feel that the mutation will not affect the type of vaccine that's going to be produced.
Okay.
See, that G variant, instead of the D, has more spike proteins. So the ability of having more spike proteins makes it now more infectious. And there are two schools of thought. One is that the G mutation actually makes it more stable. And two, it doesn't make it more stable because there are more now. There are now more G proteins around that whole crown. So otherwise, the G mutation allows now that spike protein to shift. That's the other school of thought.
So it may be more infectious, but not necessarily more dangerous.
No, more infectious, 10 times more infectious, but not necessarily deadlier.
So, Doctor, I also wanted to find out from you about some officials who are getting a reinfection of this COVID-19. What do you make of it?
I'm not there attending. But aside from the fact that I really don't know the history of some of the public officials that get reinfected or people that get reinfected, because they're not my patients and I'm not privy to their personal information. But a lot of the research suggests that coronavirus reinfection is unlikely. It may occur, but it is unlikely. And they bank on the study actually that comes from South Korea Center for Disease Control, showing that the research noted that none of the patients who actually were retested for the coronavirus transmitted the pathogen to others. And
so if you're reinfected, is it possible that the antibodies are still there?
Well, yeah, because what happens is that, like I said, this is something new, and we're still discovering it. And George was saying it a while ago. You know, sometimes you get the antibodies low already, but that's the way vaccines even have that particular premise. Because over a period of time, our antibodies go down until such a point, then we need booster shots for vaccines, or we get reinfected, and then our immune system recognizes our antibodies and then just kicks up, and so we're immune to that particular virus.
Doctor, I also wanted to find out from you, especially for people who go out to work on a daily basis, whether it be an MECQ or a GCQ, how often should they have themselves tested either by an antibody, antigen, or PCR test?
I really don't know the answer to that question as how often they get themselves tested. The medical sector, on the other hand, for the doctors, there are some hospitals that require them to get tested at least every 2 weeks, particularly those that are at very high risk. for the jobs that they do. But we do PCR. You have to remember that the PCR test is a point of care test.
Yes.
And when I say point of care, that means that if I test you today, that I only know the result today. I must know the result today because that tells me that that's my PCR status for that
But
day.
can you have a regular PCR test like every day or every other day?
No, that's too expensive, and the most of the doctors, most of the hospitals actually will require you at least once every 2 weeks, but
Right.
not in all of the doctors. Only in those that are in the high risk
Right.
units, like
No, because
anesthesiologists, for example.
presidential spokesman Harry Roque says that President Duterte regularly has PCR testing, and currently he is in what you call perpetual isolation. When you're in perpetual isolation, you have to be isolated just by yourself, and you cannot be around family members, your wife, or your kids.
Um, I I
What?
I don't know what to say about that. I don't know if it's even something that maybe it's an allegorical statement, and he was just using a play of words, which he usually does.
We'll have to leave it there. Thank you so much for your insights. Infectious disease expert, Dr. Benjamin Ko.